You have to stay within moral support.
Okay. Uh, Good day, everyone. Once again, my name is Abdurrahman Saidu with the tag number C06526. Today, we are here to talk about the project we have developed, the Care Bridge app, together with my teammate Abdullah Abdul Hafiz. Said a lot regarding that. Please, can I have the next slide? So, um, let's talk about the innovation and uniqueness of this application. There are other applications out there, but we are trying to make our own very unique so that it will stand up, so that it will stand out among others. So we have the unified healthcare ecosystem where we are going to join the doctors, the laboratory, and the pharmacy, where you are going to have your consultations all within the app without trying to, like, no, you just see the doctor here, you just recommend you to go to another pharmacy out there or another laboratory. We have a unified system in which everything that you want will do it for you there, even if it is a specialist consultation. So we have the AI assistant symptom assessment. So when like the doctor is consulting you, the AI can assist them. Maybe when you input your system or when you are having a one-to-one virtual consultations with the doctor, there's a way that the AI can assist him from your own symptoms. It will assist the doctor in making sure he gives you a fast diagnosis. The multilingual communication system. We are not only going to include English or Hausa, we are going to include Hausa, Igbo, Yoruba, TV, all the Nigerian language. We try to encompass them into the application. Then we have the pharmacy and laboratory integration. As I said earlier, we're going to integrate the pharmacy tab and the laboratory tab so that you have a unified system. Next slide, please. So these are the key features. AI symptoms triage. In case of emergency, immediately you give your what do you call it? You give the doctor your symptoms. Immediately you give the application your symptoms. It can start suggesting your diagnosis. Appointment booking, you can just come log into the app, book your appointment with the doctor. By the time you have a virtual communications with the doctor, then we have the telemedicine consultation. That's it includes still the virtual distance from no matter where you are, no matter how far you are, as far as network can reach there, you can have your consultations. We have the digital health records where all the records will be compiled there. In case of research, you still have your records, you can still access them. We have the e-prescription, that's for the pharmacy, and the referrals and admin dashboard. We'll be having rewards for referrals. So we give you a code. When you refer someone, you'll be rewarded later. Next slide, please. So the MVP, what we have now in the application, we have the registration board, we have the patient dashboard, the doctors or admin, they have their dashboard, the basic triage where you can input your symptoms and it may suggest diagnosis for you, where you make your appointment booking, where you have virtual telemedicine, virtual consultation with the doctor, then your records and referrals. No matter after how many years you come back, your records are there. Next slide, please. So the future plans. We want our app to go more to cover a wider landscape. We want it to go global out of Nigeria. So subsequently, we'll be incorporating African languages and other languages across the world. Like when you are communicating with a doctor, he only knows English and maybe you only know Swahili. So you'll be talking in Swahili, and the app, the AI, will be translating it to the doctor in the English. The doctor will be getting back to you in English, and that AI will be translating to you in Swahili. You see, so it's very seamless. So we have the EMR integration. Now we are leaving the paper base. We are going to into electronic medical records. So after 10 years or anywhere you want your records, you were in Nigeria last week, you went to China, you want your medical records, you just access the app, it will be there so that the doctor over there will consult you. Digital marketing, sorry, um, the slides are moving fast, please. Can you come back a little bit?
Yeah,
Uh,
please.
uh-huh. Thank you. Pharmacy and laboratory dashboard, I explained that earlier. Smarter AI diagnostic support to support the doctors, payment and scaling system. You will do everything in that app. It's unified. You will make your payment, we generate our revenue there. Emergency support. In case of like now you are passing, an accident occur, you don't know what to do. You can just log into our app. We have a dashboard where you can see if it is a fracture, where you can support the person. If it is a bone, what you can do. Even in the house, maybe snake bite, scorpion, or something, we implement that in case of emergency. Before you reach the doctor, you can give them first aid from our application. So we have health data inside. For the people that need our data for research, we give them that. Next slide, please. Our competitors, when you're building something, you have to look at your competitors and know what is at stake. So these are our competitors in Nigeria: DRO Health, Mobile Health Consult, Wella Healthcare, and Easy Care. We have all monitored their system, and we are seeing it's going to be more than them and unique than them, so that we'll be the top people. Next slide, please. Marketing strategies. We are going to have our hospital and clinic partnerships, so as to Apple enter the market. We partner with hospitals and clinics, healthcare professional ambassadors. We have doctor, nurses, pharmacists, laboratory physiotherapists to be our ambassadors, so that they can tell people within their own profession, so that we have more reach. We have digital marketing campaigns using our social medias. We are talking about digital economy. You have to use the social media. So we are going to infiltrate the social media very well and get known. University and medical school outreach. We go to medical schools, we do outreach, and we tell them about our app, community health campaigns, government and education referral program. Next slide, please. These are marketing potentials. We are going to go into, like,
Media.
the health. We still have people. We have over 200 million populations. So we are going to reach out to everyone. Growing smartphone adoption. Everybody has a smartphone. They can access it. Telemedicine, grow digital health transformation,
Go to your
rural healthcare.
conclusion,
Next
please.
slide, please. This is the homepage, our sneak peek. Next. This is the budget, 7.7 million for building it. Let's go. This is the projected revenue per year. So in the next 10 years, when this app is in the market, the Nigerian economy will know that there's a new player in town, because they will be having a good revenue. Next, next, next. So in conclusion, it is here to improve access, communication, efficiency, and coordination. Thank you so much.
All right. Well done. Well
Please
done,
let's put those
MC.
hands together once again.
Okay. MC, before they step down, there's something that comes to my mind. Not just you can start with your recording. I've done mine because of what I wanted to say. Um, I want to still appreciate. Let's appreciate Galaxy once again, because I did a retrospect when they started this vision, and thanks to God, I was part of the vision from the onset. It started more or less like theoretical, and last year when they wanted to do 4.0, and they brought me for an interview, that what would I expect them to do better, and I gave them my own perception that let's move theoretical to real. It has been, in academics, they do theory. It's the people out there, the entrepreneurs, put their theoretical, whatever they put in their proposal into practice. And I'm happy that my proposal, then I'm seeing the reality now. Please celebrate
Please let's
Galaxy
put our
once
hands
again.
together.
Because I'm finding this thing interesting, from the agri sector to the healthcare, and this thing are real thing that I would also like them to move it to real actualization of this dream, so that these people will be young founders, young tech innovators. So thank you very much, Galaxy. Over to you, MC.
Thank you very much. Please, you can take yours. Let's put our hands together again for Care Bridge. They are really bridging something so wonderful. There was something that caught my attention in the presentation. They mentioned telemedicine, and that's the first time I'm hearing the word. I don't know if you can quickly just tell us one thing about it while our judges are still putting their skull together. Telemedicine.
Yeah. Thank you so much. So I know from before you had telemedicine, you have been hearing of teleport. Go in secondary school, our teacher will say, "I'll teleport you to somewhere there." So this is telemedicine. Like, you may be from a far village. I'm here in the city. I can, like, administer medicine. It's like administering medicine to you from there far. So we have a visual consultation. Like my colleague here said, you may have a boil, and we have a video chat with you. You show me the boil. I can say, okay, maybe it's a weak hope or something else. This is what you are going to do to manage it. In case of prescriptions, I will prescribe the prescription for you there. I'll just send it to you. You get your drug. We can even have partnership with some pharmacies from where you are. So when you we prescribe, we just tell you to go there and collect your drug. Thank you.
Description of the drug. Thank you very much. Let's put our hands together And for me, I'm really excited. I don't want that app to comfort. I'm already feeling like a doctor because they said when you see some injuries, some accidents, you can quickly check and just quickly give a first aid support. Thank you so much for that.